Science Center. Over the next 30 minutes, we'll be talking with Dr. Chika Stacy Oriua about her journey to become a medical doctor and her advocacy and mentoring initiatives to improve racial and gender diversity and equity in medicine. You'll have an opportunity to ask Dr. Oriua questions in the chat, and we'll try to get to as many of them as we can. So get your questions ready. Please note, any inappropriate comments will be removed and blocked. Now, before we begin, I would like to acknowledge the land on which we live. As many of you may have guessed, I am not at the Ontario Science Centre right now, but I am in Toronto, where the Ontario Science Centre is located. Toronto, or Takaranto, is the territory of many nations, including the Haudenosaunee, the Wendat peoples, the Anishinaabeg, the Mississaugas of the Credit, and is now home to many diverse nations, Inuit and Métis peoples. Toronto is also covered by Treaty 13 with the Mississaugas of the Credit. Now, whenever I do a land acknowledgement, I always think of my own history as a child of immigrant parents who settled here in Toronto when I was very young. Today, I am grateful to be able to live and work on this land alongside Indigenous peoples who have cared for it since time immemorial. Some of you may be joining us from outside of Toronto. Tell us where you're joining from in the chat. We encourage everyone to do more and to learn more, reflect more about the peoples, treaties, histories, and the land where we all live. Two resources that you might find helpful that were created by Indigenous peoples are an app called Whose Land, which is available on Google Play, or the website native-land.ca. Now, land acknowledgements make us think deeply about our histories and how we engage, not only with the land, but with other people. They remind us that not all people have been or are treated equally and fairly in Canada because of discrimination based on race, heritage, gender, and ability, among other things. They also help us think about who gets to write and make history and whose stories get told and remembered and why. You may be wondering, what has this got to do with science and technology? But think about how we talk about the history of science and technology. Have you noticed that when we talk about famous scientists in history, we're often emphasizing the achievements of some people and being the first to do something, to discover something, to invent something? You could probably find it easy to name a few in the chat. Now, if you are putting names of famous scientists in the chat, what do these famous scientists you've named have in common? It's funny because we don't often think about the cultural and social context in which scientists can make those achievements happen. You know, and then over time, we come to expect that only certain types of people really can become scientists, doctors, or engineers. We don't even question how sometimes our society and environments might actually be discouraging the dreams of racialized youth, Black, Indigenous students, and other people of color who are otherwise quite capable of choosing and doing real work in careers such as science and medicine. Now, somebody who is doing something to change all of that is our guest today, Dr. Chika Stacy Oriua. She began her medical studies as the only Black person out of 259 students at the University of Toronto's Faculty of Medicine, and last year she became the first solo Black valedictorian to address her graduating class. She is now a resident doctor in psychiatry and is training to specialize in neuropsychiatry and neuroinflammatory diseases. She is also a professional spoken word artist, a public speaker, and writer, and was appointed to the board of directors of Indigo Books and Music last year. Welcome, Dr. Oriua.
Thank you so much, Michelle. It's an amazing honor to be here today.
Yeah. Now, if you have questions for Dr. Oriua, please put them in the chat. And as I said, we'll try to get as many of them as possible. But Dr. Oriua, I'm going to start with the first question. Since we have so many young people joining us today, and I'm going to guess that a lot of them are considering careers in science and medicine, could you tell us when you first knew that you wanted to become a doctor?
Of course. So I actually am one of those people that kind of say I've always known I've wanted to be a doctor. My mom said that some of my first words when I was like old enough to form coherent sentences and really be able to say what I wanted to be. She says, I always wanted to be a doctor, even from very young age, like 3 or 4. And that was mostly because I loved being around babies. And my uncle is a neonatologist. And so I knew that he took care of babies. And so I was like, okay, well, I want to do what he does and I want to be a doctor. Of course, at that age, not knowing what it really takes to be a doctor and how long the road is, but just having that appreciation. And then going on through elementary school and high school and realizing that I had a natural love and knack for sciences and math and English, and medicine really is just a marriage of all of my different passions. And so I was very fortunate that my skill set kind of naturally aligned with what I thought I wanted to do when I was very young. So I was kind of lucky in that sense.
Wow. No, did you have a favorite science?
Definitely biology. I still really, really, really love biology.
What was it about biology that you really loved?
I've always just been really fascinated by human anatomy, I would say, and just really understanding the different mechanisms and intricacies of how the human body works is something that I've always found really fascinating. And so it also kind of lends into my interest in neurology and psychiatry and the brain, the human brain, just wanting to understand how the brain works. And so I've always kind of had that love for biology ever since elementary school, and that's just really stuck with me throughout the years.
We actually have a question coming in from the chat. I believe it's from Vobi. Is it very difficult to study for being a doctor?
That's a great question. Short answer, yes, it's tough. Medical school is definitely difficult. Becoming a doctor is difficult, but it's not impossible. It is not an impossible or insurmountable task. Certainly, if you have the passion, if you have the ambition and the grit, then you can become a doctor. But it's not an easy path by any means, but it is so, so, so worth it.
Yeah, it's a lot of school. How many years of school is it to become a doctor?
Okay, so it's about after you finish high school, it's 4 years of university or 3 years for some people. And depending on the medical school, it's also another 3 or 4 years, so upwards of 8. And then you do residency, which is another, for some people it's 2, but it can be upwards of 5 to 7. So you're looking at 13, give or take, years after you're done high school. But the good thing is that once you're done medical school, you start getting paid to get trained, but still, you're still in training or in school for a very long time.
Oh, wow.
Mhm.
Oh, actually, I see a really interesting question from Carissa.
Mhm.
It kind of speaks to what we were talking about in the introduction.
Mhm.
She would like to know, Carissa would like to know, what were some of the troubles, your troubles becoming a doctor being Black?
It's a great question. I would say probably the number one, or actually there was a few difficulties, one of which was not necessarily having access to a lot of mentors in the field who can demystify or clarify the process of, how to get into medical school. Because it seems kind of straightforward, you apply to medical school or you do well in school and you should get in, but really there's a lot more nuance to it. And some people have a lot more early exposure to different resources that can assist them in getting into medical school, even as early as high school. And so that was one thing that I didn't necessarily have access to. But the other thing was also kind of facing invalidation. So there were a number of times where I would tell people that I wanted to be a doctor, and people would kind of look at me strange or say, are you sure that's what you want to do? Or accuse me of lying. And that kind of invalidation was really, really difficult. And there are other reasons, but those are kind of, the core ones.
Yeah, that invalidation, it comes in so many different ways, right? I think while everyone's experience is unique, in some ways, I think a lot of people can relate to how intimidating it might feel to just be different, for all sorts of reasons. To be the only person in a large group of people who maybe don't share the same life experiences as you, it can sometimes feel a little discouraging to try and be a part of that group. I remember growing up how I was always being told, "Hey, girls don't take shop class. Why do you want to take shop class?" And that's all I really wanted to do. I mean, and nowadays people won't say that out loudly,
Mhm.
but it still sometimes feels like some people aren't supposed to be in certain fields and certain or do certain things. I was just wondering, why do you think it's so important to have like more diversity or representation in medicine and medical school?
Mhm. So, having diversity in medicine is so important for a multitude of reasons. A couple of the main reasons. One is that it enriches the learning experience for everyone who's in medical school, and it introduces fresh and new diverse perspectives into the medical class. It makes you think differently when you have people from different walks of life who are introducing new topics related to the health of certain communities that otherwise might not have been brought into the picture had there not been a diverse medical class. The other important reason is that having diversity in medicine actually feeds back to the kind of care that we're giving to the community. So, statistically, physicians who are from underrepresented backgrounds are more likely to go and serve in these communities that are traditionally underserved. And the last reason is that representation, as you mentioned, is so important. Growing up outside of my uncle who doesn't live in Canada, but growing up in Brampton, Ontario, I did not see any physicians that looked like myself. The closest Black female doctor that I saw was on Grey's Anatomy, and as we know, that is a fictional show. But I certainly did not see any Black female doctors for years and years and years. And so, kind of having that lack of tangible representation makes you doubt that someone like yourself actually belongs in that space. So when you have increased representation, then it allows for other people who are interested in medicine growing up to see, wow, this woman looks like me, or this person looks like me. That lets me know that I'm more than likely to be welcome into that space if that's something that I want to do. So if you can see it, then you can achieve it. And that is really, really important when it comes to representation and diversity in medicine.
Wow, that seems like such a big challenge to overcome. I have another question here from Julia. She's actually asked, what other kinds of challenges do you go through just, to be when you're being a doctor?
So being a doctor, it's an incredible, incredible profession. One thing though is that it is a pretty hard road of training, and it can be a little bit mentally taxing, actually quite a lot mentally taxing at times. During medical school, you have to study a lot and you spend a lot of hours in the hospital. And now that I'm in residency, it's kind of hard to find a balance between what, being in the hospital, being on call for 30 hours at a time, being awake for days. It can be very, very exhausting. And then trying to find the balance between that and my personal life and self-care and, finding the different ways to enrich myself outside of medicine. And just to clarify the kind of doctor I am. So I'm in my residency right now for psychiatry. And so my specialty is looking at psychiatric illnesses. And these are mental health concerns like depression, anxiety, but also more serious mental illnesses like psychosis that we see in schizophrenia, sometimes bipolar illness. So, kind of encompassing all of the various ways in which the mind can become unwell.
Oh, so I have a question here from Kira Rinaldi. One of her students asked, "Why did you want to become a neurologist?" Or I guess that you're not quite a neurologist, right?
Yes, so it's a bit different. So neurology looks at kind of the structural diseases of the brain, whereas psychiatry looks more at the illnesses of the mind, but can also intersect with the illnesses of the brain. And so it's interesting because neurology and psychiatry are very much like sisters with regards to the specialties. But what made me want to choose psychiatry is because I realized that as an advocate, as a natural advocate, I wanted to choose a clinical career that allows me to extend my advocacy into the work I'm doing as a doctor. And oftentimes mental illnesses and people who experience mental illness are marginalized. So they're pushed to the side, they're stigmatized, and they don't receive the care that I believe that they deserve. And so being a psychiatrist necessitates that I'm an advocate for individuals who are experiencing mental health. And that for me was just what I felt was the most natural inclination of my skill sets.
Yeah, and that mental health is such an important topic, especially during this pandemic, and especially for a lot of the young people in our audience right now who, had their whole school year, you know, um, um, uh, readjusted because of the pandemic and all the concerns now. So we have a question from a student at Castlebrook Secondary School. How do you keep motivated for all those years in medical school, and how do you keep going?
It's a great question. I would say that certainly I try to hold on to my why moments. And I use this not only within medicine, but also within life when it comes to my advocacy and other goals that I'm trying to achieve. But I always try and find my why moments on a day to day basis. Every single day, I'm reminded of a clinical encounter that strengthens and reiterates why I am meant to be a physician. And sometimes it's a simple encounter with a patient who's just expressing gratitude for the work that I am doing. Sometimes it's a really cool slam dunk diagnosis or diagnosing something that's rare or interesting, and just very fascinating. But usually holding on to those why moments of that just remind me exactly why I chose medicine. And usually it comes down to the patient interactions and just being able to see someone go from being very, very sick to being well, even in the absence of gratitude, but just seeing their own personal evolution, or being there for someone's family when that person is very sick and they might not get better. So there are just so many moments that I have on a daily basis that allow me to get through the years and years and years of training that remind me what an incredible privilege it is to be a doctor. And it is such a privilege to be able to see people at such a vulnerable point in their life. And that to me is something that I really don't take lightly.
Wow, I really love that. And I'm just wondering if people in the audience can relate to that question of finding those why moments. It's kind of like finding those purposes and in life, right? That help keep you moving forward. Um, Now, I was just wondering, like, in terms of like the there's the medical school, which is hard enough. There's the challenge of the pandemic, which is hard enough, and now, and then added to that is racism and discrimination based on, not just your race, but also your gender. Um, were there ever times where you felt like, oh, this is too hard. I just want to give up. Because it doesn't seem fair that you're the not only are you the only Black student in your class, you face all of these extra challenges that other people don't necessarily have to endure, and then you're also asked to be part of the solution. Um, you know, uh, to address, the years and years of racial and gender inequity in all sorts of fields. So I was wondering if not just how to stay motivated, but what advice would you give young people in our audience to take on that advocacy mantle that you've done in your work?
I'd say the number one thing I would advise is to find a mentor and to find like minded allies. To find your community is going to be so important, because I could not be in the position that I currently am in today as an advocate and also as a mentor and as a physician if it wasn't for the incredible, incredible mentors that really shouldered me and came around me and protected me during the hardest times of medical school and now into residency. It certainly would not have been possible without that community of support and the allies. And that your allies don't necessarily even need to be, from the group that you identify with. Usually they aren't in the group that you identify with, but certainly being able to find that community of allies and mentors is the number one thing that helped me. And I believe if you're interested in advocacy, certainly that's something that I would encourage you to pursue as well.
Yeah, it seems like a tough going thing, but I really, your story became such a big media attention, a big piece in the media last year when you became your graduating class voted you as the sole Black valedictorian of your graduating class, and you may have started as the only Black person in your first year of medical school, but thanks to your initiatives and mentorship, last year, 24 Black students were admitted to the University of Toronto's class of 2024 medical school. And it's the largest in Canadian history. So I was just wondering if you could talk a little bit about some of the things that you were involved in to help recreate like change the narrative a little bit at U of T, and other advice you might give to some people in our audience who might want to start similar initiatives and networks like you did.
Certainly. So I was invited to be an ambassador for the Black Student Application Program when I was in my first year of medical school. And that is an initiative that is not quota based, and it has the exact same criteria as the regular stream of application. Really, it just tries to improve the implicit bias in the application process for Black identifying individuals. And I took on the role of being the public ambassador, so doing a lot of public facing work and education work, while also advising the implementation, and then also providing mentorship to the individuals who were introduced in through the program. And so that was such an incredible legacy to be a part of, and is certainly one of the things that I am most proud that I'm a part of. And for those who are interested in getting into that kind of work, certainly I would say, once again, it's so important to find that community. And it's really important to kind of dig within yourself and find what your convictions are, which means understanding what it is that you stand for and what it is that you don't stand for. And for me at the time, I was kind of dealing with a lot of conflicting opinions, people who were saying that if you stand up for this might affect your chances at matching to your dream residency or your career, because it's something that's, a hot button issue. It's kind of contentious. But for me, realizing that risk and standing by my convictions and doing what I believed was right outweighed any of the other issues that I was contending with. And so I'm very, very incredibly fortunate and so thankful that I decided to take that risk with the mentors and with the community that I had in order to do that advocacy work. So certainly, if that's what you're interested in, digging deep within yourself, understanding what your kind of core values are and what your beliefs are, and doing what you believe is the right thing to do and doing it correctly.
Yeah. Now that's kind of interesting. Like, I love how you're kind of, for me, reshaping the idea of mentorship. We often think of a mentor as somebody who's experienced, who helps guide the next person along, who may not be as experienced, but kind of dismisses the life experiences that the student or the person who's being mentored might bring, and and I kind of like the idea of the whole of creating communities of mentors, maybe where we're extending hands out to everyone else, and creating those networks where we can be each other's safe spaces. So
Exactly.
the person who's the guide, not just the guide or the inspiration, but somebody who is the person we could confide in or feel encouraged, or what you said earlier, the one who helps make us feel validated just for who we are. It's interesting. There's a question here about how many medical schools did you apply to, and what activities did you complete that made you stand out for your med school application? And I love this story. This is a question from Janice Hughes. So could you share?
Sure, great question. I applied to 4 medical schools, the Ontario medical schools. There are more than 4 within Ontario, but I applied to 4. And that's actually not super common. It's more common to apply a lot more broadly. And I would encourage you to apply a lot more broadly. I was just kind of really dead set on staying in Ontario. But the courses that I took are kind of your basic science courses. If you want to apply more broadly, doing your physics and doing your English and doing kind of all that at the university level is really important. I feel like I'm dating myself because I don't remember what all the criteria are. But certainly there's like a very clearly defined list on OMSAS as to what the different schools' different criterias are for each subject matter. And I'm a slam poet. I'm a professional spoken word artist, and the good chunk of my CV was actually dedicated to poetry. And the essays that I wrote for the University of Toronto, a lot of it was talking about poetry, because I felt like your authenticity is ultimately going to shine through. You need to write about who you are and what makes you authentically yourself. And so I wrote extensively about poetry. I wrote extensively about the things I love. Like, I love talking about natural hair care in the Black community. I wrote about that. Of course, I had some research in actually psychiatry, even though I wasn't super interested in psychiatry at that time, but I had some research into maternal mental health because I was really passionate about it. And ultimately, that was kind of my mantra. I actually, didn't volunteer in hospitals. I didn't have that much research, like basic science research on my CV. Not to say that that's not what could get you into medical school. Certainly, a lot of people have that, but for me, I just really stuck to what I genuinely enjoyed. And I would encourage you, as if you're really interested in medicine, as you're going through high school, undergrad, graduate school, to do what you're passionate about, and that will come through in a medical school interview. I assure you that much.
That's great. I love that because we're more than just our knowledge and skills, right? We're all rounded people. Every person in the audience has more than just what they know or what they learned. And you got to bring all of it to it, right? And it does make you well rounded. I believe we have just a few minutes left. I'm wondering if there's a question in the audience. Actually, here's one. This comes from Rishvika Lawrence. Was there a specific person that motivated you or inspired you through difficult times?
The number one person would be my mom, 100%. She is my absolute inspiration. And she's a personal support worker, but she worked two jobs my whole life and still does. And I think I get my tenacity and my grit from her. And so 100% my mom. But if we're thinking more of like medical mentors or people within the medical community, there's a few physicians, Dr. Onya Norum, Dr. Lisa Robinson, and Dr. Pierre Bryden, who are fantastic female clinicians at the University of Toronto, who were amazing, amazing mentors and really honestly protected me throughout medical school. So shout out to them.
Well, the last thing I'm going to leave you with is a quote from your own valedictory speech that you gave to the graduating class at UT. You said that with a community that stands behind you and a mentor to guide you, you can take the risk that might move mountains. I was just wondering, before we wrap, if there's any advice or last words of wisdom that you could share with our audience today.
I would say fearlessly follow your dreams, fearlessly follow your passion. And, even though the road might seem long, especially in medicine, I assure you it'll be worth it with whatever you put your heart to. That's what I would say.
Oh my gosh, I feel so honored to have spoken with you today.
Like,
And I want to thank you so much for your inspiring words, your inspiring story, for helping us rethink the stories that we tell ourselves about who gets to be in science, who should be in science, who belongs in science and medicine. I hope all of you in the audience feel encouraged by Dr. Oryua's story and that you go out and find a mentor or be a mentor or take risks and follow your career path wherever it takes you. Now, our recording of this live stream will be found on our website, www.ontariosciencecentre.ca, and our other social media channels. Tune into our live stream events every other Wednesday at 2 p.m., including our upcoming event with Science North on June the 2nd, which will be all about the great outdoors. Don't forget to follow, share, and like us on our social media for updates on all our upcoming events and other great science content. Thanks again to our guest speaker, Dr. Chika Stacy Oryua, and to you for watching and engaging. My name is Rochelle, and I hope to see you again at another Science Center event.
thank you
Bye.
so much.